This is another good study that demonstrates that COVID rapid antigen tests are a good indicator to tell if someone is infectious or not, meaning that if you test positive in a COVID rapid test, you're definitely infectious to others. So, while reverse transcriptase PCR remains a gold standard for the detection of COVID, a positive result on these tests does not necessarily correlate with the infectious status of the person, meaning that if you are PCR positive, you're not necessarily infectious to others. However, the authors wanted to test a COVID rapid antigen test to see if it was correlated well with virus infectivity, which they're examining through virus culturing. To test this, they cultured 163 respiratory samples collected from 26 COVID infected patients, where they concluded that rapid antigen testing could be a great alternative method for determining if a person is infectious to others or not. As a reminder, most rapid antigen tests use the nucleocapsid protein, the N protein on COVID, to detect if COVID is present or absent. This is different from PCR that looks at the viral RNA. So most of us by now are familiar with the spike protein that's present on the outer surface of COVID. Well, the nucleocapsid protein is actually inside of it. So, pardon the pun, on the surface, it's not necessarily telling you if the virus is alive or not. But due to the collection process and the stirring process, you'll actually be breaking open the live COVID particles to expose the nucleocapsid protein. And if that nucleocapsid protein is present, a reaction will occur, generating that second pink line. This study was performed at Taoyuan General Hospital in Taiwan between November and December of 2020. To be eligible for the study, you had to be greater than or equal to 18 years of age, so you had to be an adult, and then you had to have your infection confirmed with real-time PCR. 26 patients were recruited for the study, and nasal swabs were performed. This was done each day during their stay in the hospital until the real-time PCR results became negative. And then, in like the previous study, they did viral culturing to determine if the virus was still replicating or, air quotes, still alive. Interestingly, in this study, there were no false positives, but there were a lot of false negatives on the rapid antigen testing. And what they found was that when the cycle threshold value was lower than 30, so that would be a mild infection or possibly an asymptomatic infection, the rapid antigen test still had over 70% positivity. But as the cycle threshold value decreased as the person got sicker, the severity of the COVID increased, then so too did the sensitivity of the test or the ability to pick up on COVID if it was present. Meaning that as the viral load increases, so too does the sensitivity of the test. So much so that when the cycle threshold value was 20, the rapid antigen test positivity was 100%. But importantly, when the cycle threshold value was greater than 30, so this would be getting close to not having an infection, then the sensitivity of the test dropped significantly. Importantly, rapid antigen testing has a high false negativity rate, meaning that you're getting a negative result in the COVID test when you're actually COVID positive, when you have a COVID infection. So for instance, in this study, there was 163 PCR positive tests, but the rapid antigen test only picked up 41 of those. However, the authors found a very high consistency between virus isolation, the ability to detect replicating virus, and a positive rapid antigen test, specifically if the person had a moderate to severe COVID infection, where the cycle threshold value was lower than 25. And also of note, the rapid antigen test has a good sensitivity versus virus isolation in asymptomatic patients. For example, while they only had 6 asymptomatic patients in their study, the COVID virus could be detected through the rapid antigen test in 5 out of 6 of their patients. And from these 5 asymptomatic COVID patients that had a positive COVID test, they were able to successfully isolate virus, meaning that these people were contagious, ultimately demonstrating that the rapid antigen test could be used to distinguish contagious people from non-contagious people. And then again, 2 things to consider. If your infection is early on, you might test positive on PCR but negative on rapid antigen testing. If that happens, definitely believe the PCR test, you are infected. So seek out your antiviral treatment if available and if possible. And additionally, as we as a global society continue to allow COVID to mutate unchecked, continued mutations to the nucleocapsid protein can contribute to false negative results of rapid antigen testing. And over the past 5 years, specifically over the past 2 to 3 years, we have seen that the nucleocapsid protein is indeed mutating, which is good reason to update our COVID rapid tests to more current variants.